And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today is Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411. Or you can visit the website at www.southwestpaingroup.com. Now, one of the tools used in pain management is the ultrasound machine. And Dr. Bulger, ultrasound goes back to beginnings in World War II and sonar.
That's right, Mike. It's actually a version of sonar. Now, a lot of people know about ultrasound because you have one when you have a baby and you're interested in the progress of your infant. But if you look at the slide, you'll see that it was first developed in World War II to help the Allies detect enemy submarines. But today we're using it to help locate pain. And one of the cool things about ultrasound, which is exciting for us in pain management, is the fact that ultrasound allows us to locate a painful area and inject a joint much more easily. For example, in the olden days, we could use an X-ray machine or we could feel around. With ultrasound, if you look at the monitor there, I can locate her joint. And I can locate the shoulder joint and the bursa. And if you look at the first picture on our slide for the audience, you'll notice something interesting. With the ultrasound, you can actually see all the tissues. You can see the muscles, the tendons, the ligaments. And if you look at the next slide, where the regular X-ray, our audience is probably noticing this X-ray, you don't see that. You can't see any of the important tissues to inject the shoulder. So in this case, if I want to inject her shoulder, all we have to do, and I want to emphasize for the audience that obviously we use sterile conditions, syringe, needle. We're not doing that today, of course. but normally we would inject these things, and the ultrasound allows us to locate things. If you look at the
now, what are we looking for? Are you looking for maybe a tear in a muscle, Dr. Bulger?
Well, now, if you look at the next monitor image on our monitor, what you're going to notice is something interesting. That if you look at the if you look at that needle right there, you can see the red arrow shows the actual needle. I can actually guide the needle into the joint, and I can put the medicine in the right spot.
Exactly where it needs to be.
And that's the key thing, Mike, is that with ultrasound, we're actually able to put medication in the exact location, and which we're not always able to do before. If you look at the next image for the audience, what you're going to see something very interesting. With the ultrasound, you can see that green arrow shows exactly where the medicine's supposed to go. And another important thing about ultrasound is it makes sure we don't put it in the wrong spot. So for example, if you look at the next image overhead for our audience, what you're going to notice is that those yellow arrows show where the bone is. We don't want to hit the bone. We don't want to cause infection. So one of the cool things about ultrasound for the audience is to know that ultrasound allows your pain management specialist or physician, whoever's using it, to put the medication in the right spot. I'd like to show the knee joint now too. In a similar way, if you take a look at this, our monitor and our live image, we can actually see the knee joint. And it's actually very, very easy to see the patella, the knee. You can actually diagnose things. You can also place the medication in the right spot. Now, so if you go ahead and take a look at our image overhead for the audience, what you're going to notice on the next image is that the little red arrow there shows the audience where the biceps tendon is, and that's important. When we inject tendons, we don't want to actually go in the tendon. We actually want to just put the medication around the tendon. So that's one of the great advantages of this, is that it allows us to put medication in the right location. And that's one of the most powerful things about it.
So with sonar, just to kind of recap, we can see exactly where the problem is.
Right.
We can put the medication exactly where it needs to be, the right medication, so the healing process is going to be a lot quicker.
Well, there's a lot of advantages. First of all, there's no X-ray. In my office, I can roll this machine from room to room, and I can quickly find out where the problem is. I can put the cortisone medication in a knee joint, a shoulder joint, a trigger point, and actually you can do diagnosis with ultrasound as well. You can locate painful tissues. You can locate edematous tissues, joints, and yes, we can do these things with X-ray, and yes, we can do them kind of just by examining the joint like we were trained to do, but in reality, the ultrasound machine gives your pain doctor a way to really find the painful area quickly, and with a lot less muss and fuss. By the way, less cost. X-ray machines cost a lot more than ultrasound.
Sounds like a deal. Now, if you have any questions regarding ultrasound, or if you'd like to make an appointment, just go to southwestpaingroup.com, and we'll be right back with some questions.